My name is Rachel Coker. I'm part of the planning committee for the program, and we're so pleased that you could join us. We do have an exciting speaker lined up for you this morning. Jamie Floyd will be talking to us about health and health disparities and reflecting a little bit on the really unusual experiences we've all had in the past year. We're looking forward to her talk and to taking your questions as well. Throughout the morning, if you have any technical issues and you want to approach me in the chat, find out if you can't hear or if no one can hear, you can find me in that chat box. We will be sharing some resources with you throughout the morning, links to our sponsors as well as to some of the recipients of funding through the Women's Fund. So keep your eye on that box. That's also where you'll learn if you've been chosen for one of our door prizes. We hope to be delivering those in person to many of you or popping them into the mail very soon. And I think without further ado, we're going to get started here. So I'm going to put everyone on mute except our first presenter, Sandra Johnson, and away we go.
Good morning and welcome. I want to make sure I'm up there. Great. Okay. Good morning, everybody, and welcome to the 16th Annual Women's Fund Breakfast. Good morning. My name's Sandra Johnson, and I am this year's chair of the Women's Fund's Leadership Committee. What a crazy year it has been. I'm so glad that it's starting to flatten out again. I am so happy that we're back, at least virtually this year, to celebrate together and recognize the wonderful achievements of the local inspiring women and local deserving organizations. First, I want to quickly recognize the hard work of the Women's Fund Committee puts into this event every year and applaud those who have helped to make this event and have it take place in 2021. As a mother of a 10-year-old girl, I'm constantly reminded of how important it is to instill and teach her the values that will help mold her into a caring, responsible citizen and a good human being. A good human being sounds pretty simple, doesn't it? Today we are recognizing women and who became those caring, responsible citizens, and we are recognizing them for helping make our communities a better place for all those working and living here, and for those little girls like my daughter who inspire to make a difference and just be good human beings. I end with a quote of my favorite legend, Judy Garland: "Be a first-rate version of yourself and not a second-rate version of someone else. Be a good human being today, and let's continue to make a difference." Thank you, and now I would like to introduce a message from our signature sponsor, Excellus Blue Cross Blue Shield.
Good morning, and welcome to the Women's Fund's 16th Annual Breakfast. I'm Jessica Renner, Regional President for Excellus Blue Cross Blue Shield here in our Southern Tier region. We are very proud to be this year's signature sponsor of the Women's Fund Breakfast. The Women's Fund Breakfast is an event that I look forward to every year. Seeing the grant recipients and hearing their stories, and understanding how the funding impacts women and girls in our community. I'm also so very proud that Excellus Blue Cross Blue Shield recognizes that empowering women is essential to health and the social development of our families and our community. Thank you to the Women's Fund and to the Community Foundation of South Central New York. You continually enlighten us, empower us, and provide the much needed support for women, for all of us.
We would also like to thank all of our generous sponsors. Our signature sponsor, our gold sponsors, our silver sponsors, and our bronze sponsors. Thank you again to all our sponsors. We truly appreciate all of you and your generosity to make this event Great. Now I would like to take a moment to share a brief video highlighting a few of our current grantees, recent grantees.
Hi, my name is Sharon Chesna. I'm Executive Director of Mothers and Babies Perinatal Network. We're very thrilled to have had the opportunity to receive a grant from the Women's Fund of the Community Foundation for South Central New York for our collaboration with United Health Services, working with women in their methadone clinic. This is definitely benefiting the women who are in the program. It has enabled our agency to further our collaboration with UHS by offering this Baby Basics, an evidence-based curriculum program for pregnant women who are working towards recovery at the methadone clinic. Again, we would not have been able to do this without the support of the Women's Fund. So thank you very much.
We advocate. We've been to Albany. We do the tabling. We try to do what we can to help people. We've taken the lessons for the Narcan training, and we just do whatever we can to help.
I would like to share with the Board of Trustees from the Women's Fund how the scholarship from the Entrepreneur Academy helped you. Please, would you share with them, in few words, how this impacted you?
Absolutely. So if it wasn't for this scholarship, I wouldn't have been able to attend at all. So I'm very, very grateful for that. I am a person who is trying to get my program up and running, and I really learned a lot. And during this time, I actually have brought my program to a larger organization, and I'm very grateful for the support and education that I've gotten because it helped me tremendously along that journey. So thank you very much.
Congratulations, and thank you for sharing your stories. Now I have a message from Rita Ernstrom, the chair of our development committee, who will highlight a few of our grantee recipients and why it's so important to support our local women and the girls in our region.
Good morning, everyone. I'm Rita Ernstrom, and I chair the development committee for the Women's Fund. The annual Women's Fund Breakfast is our signature event where, as you've just seen, we share our mission by celebrating the work of our grant recipients and hope to inspire all of you to become a part of this amazing, collective, philanthropic force that has such an impact on the girls and women in our communities. And we are a force. The original challenge was if we could get 100 women to each give $1,000, think of what we could do. Since 2002, the Women's Fund, with over 1,000 donors, has made over $240,000 in grants to over 90 projects and programs. From Mom's House to programs like Girls Who Run, Project Voice and Stand With Me, which are 2 programs supporting female veterans, Restorative Justice through the Oxford Youth Center, the Girl Scout STEM Lab at Amahami, Opportunity for Otsiego's Violence Prevention Program, the initiative Women Who Lead, to name just a few. And our latest news, the Women's Fund Endowment has reached $1 million. I'm a founding donor, and I'm also a donor to the Empowerment Society. Why do I give? Well, originally, I was inspired by the vision and the mission set forth by a very special group of women. To date, more than 2,000 women and girls have received direct assistance, training, or services, and hundreds more have been positively impacted by Train the Trainer projects. Over 200 Women Fund donors have participated in the grant-making process, and hundreds of women and men have learned about the power of women's philanthropy. I give because I believe in girls and in us, as women, collectively giving, supporting each other. I also give because I'm inspired. I'm inspired by other donors, by the grant recipients, by the volunteers, and by the staff at the foundation. By them all, for what they envision and how they make it happen. They are the force. I sum up that force with 5 words. Empowered women empower other women. Today, I invite all of you to become a donor or renew your gift to the Women's Fund. Our history shows the power of women's philanthropy is collectively we can do amazing things. And it also shows philanthropy isn't measured only by the amount, but also by the heart. Amy Dickinson, who was a speaker at a previous Women's Fund breakfast, has written, "Real queens fix each other's crowns." I love that sentiment, and that inspires me too. Today, I hope you leave feeling inspired, empowered, and thankful, and wanting those things too for girls and other women. So today, on behalf of the Women's Fund, I thank you for attending the breakfast and also supporting the Women's Fund.
Sandra, you're on mute.
There you go. See? Thank you. Thank you, Rita, for that powerful appeal. At this time, I would like to introduce our main speaker, Jamie Floyd. And a special thank you to Jamie for sticking with us for the last almost 2 years. And because we were ready to welcome you in 2020. And then we all know what happened. Let's fast forward to 2021, and we're able to enjoy our time with you now. Here's a little bit more about Jamie. Jamie Floyd is a former WNYC host of the morning edition and current senior editor for Race and Justice in the New York Public Radio. She is also a Binghamton University graduate and a political legal editor in the WNYC newsroom. Jamie was born and raised in New York City and grew up listening to WNYC. She has been a news junkie ever since childhood, when she delivered newscasts to her grandmother from the dining room table. She went on to serve as editor-in-chief of her high school newspaper, ombudsman of the college newspaper, and DJ for WHRW, the campus radio station at Binghamton University. At Berkeley Law School, she was selected as an associate editor of the California Law Review, where she also published. In a journalism career that spans 2 decades, Jamie has worked on everything from breaking news to exclusive interviews to long-form investigations. Jamie has won numerous awards in journalism. She was twice nominated for a TV News Emmy, once in 1999 for her coverage of the John Kennedy Jr. plane crash, and again in 2001 for her work at Ground Zero. Thank you for joining us, Jamie. The screen is all yours.
Good morning. Good morning. Thank you so much for that introduction. And I have to say that you mentioned my grandmother, and it warms my heart. I wear the same chain my grandmother wore. She was born in 1896, and she wore this every day until the day she died, and I wear it now. So I'm so pleased that you mentioned her. She was not a New Yorker. She died in New York. She was a New Yorker at the end. So thank you for having me. And that's a wonderful way to begin my morning, with thoughts of my grandmother who lived with us. And I grew up with her, and it's just a wonderful, delightful memory. And that was a lovely introduction. I'm so happy to be here. I too am sorry that we can't be in person. That was our original plan when we started to talk about this breakfast back in 2019. But we've also decided today that we'll do it again in person soon when we can. So I will be back. But let's talk about what we're here to talk about today. It is, a tribute to this committee and to the fund that they stuck with it. They persisted. They kept emailing and pinging me and got me here. And we get to spend some time together. As you've just heard, I stepped away from my role as the host of All Things Considered during the pandemic last September to become the senior editor of New York Public Radio's new Race and Justice unit, just last September. And we launched the unit the day after Labor Day. And I took on this critical assignment because I really do believe that gender and racial inequities are at the root of so many of our problems in this country. But I also believe, I believe then when we launched the unit, and I believe now that we stand poised to tackle those problems head on. And in our Race and Justice unit, we have a small team of dedicated reporters who work to bring greater rigor and focus and urgency to the work of exposing the persistent inequities in government, business, and even in culture. And we believe that smart journalism and reporting can really provoke civic and civil discourse and impact our communities in meaningful ways. And I really think in our short 9 months together reporting on these topics, the work of our unit has started to shine a light on the healthcare inequities that we're here to talk about today, the economic inequities that we hope to begin resolving in reopening, and we'll talk a little bit about the reopening as well. I just want to mention quickly some of the things we won't talk about today, but that we also cover in our Race and Justice unit. Of course, we cover quite a bit the criminal justice system, including ways to recalibrate the treatment of African Americans in the system. We just launched a project called 24 Minutes in Mott Haven, all about the interactions between the police and protesters last summer. You can find that at our website, gothamist.com/24minutes. And we've been covering, I'm sure you won't be surprised to hear, the rise in hate and bias in our country, and yes, in our region too, even in New York City, quite a bit in New York City. We're also often at the nexus of law and journalism. In fact, later today, I will be on the air talking about the current Supreme Court term, which is one of my favorite things to do in my daily work. And we also have some fun. We recently were involved in a fully bilingual Romeo y Julieta. Let me try again, Romeo y Julieta, in partnership with the Public Theater in New York. And it starred Lupita Nyong'o as Julieta, and you can still hear it wherever you get your podcasts. And even if you don't speak Spanish, I urge you to listen to it. It is gorgeous. And it was really fun. And in the midst of the pandemic, it was a joyful delight to lean into something that was about art and words and language, Shakespeare, sound, performance. It really lifted up my soul. So that was, and it was about culture. So we got to participate in that. So beyond that, I'll just say that my role in this Race and Justice unit work also means that I help guide WNYC's editorial policies. I guide content in a way that speaks to the diverse citizenry of New York City and New Jersey, New York State, our listenership broadly. And I'm really happy to answer any questions you might have about the work when we get to the Q&A. This has been an extraordinary year for all of us, and as you can imagine, for journalism and journalists. And I'm happy to talk about that if you like when we get to the Q&A. But now that brings me to our topic today. I've been asked to speak about two key things that our unit covers every single day, and I do in my work every day: healthcare and reopening. So let's start with healthcare, and specifically healthcare disparities. It's a very big topic, and I'm going to break it into 5 key bullet points. You're probably thinking, what does this woman know about healthcare? She knows a lot of things. She's a lawyer, she's a journalist, but she's not a doctor. She's not even a public health person. But actually, I worked in the White House under Hillary Clinton in what we called then the healthcare. It was originally called the healthcare war room, and then Hillary came on in and she said, I don't like that war thing. I'm going to call it the healthcare delivery room. So I worked there on healthcare policy. And I've covered, as you can imagine, the ACA, Obamacare, litigation, legislation, and all of the challenges to it for these many years from my position as a legal analyst. So, you know, I don't know everything there is to know about healthcare, but I know something. And so we are covering healthcare disparities quite a bit in the Race and Justice Unit. And, you know, in this work, I've seen the clear intersection between and amongst the disparate impacts of COVID-19, the ongoing incidents of police brutality, the recent rise in hate crimes, most recently anti-Asian hate and bias, that have brought healthcare and health disparities into sharper focus amongst the media and the public. But I think we all know that health and healthcare disparities are nothing new. They were just illuminated by COVID-19. These disparities have been documented for decades, and they reflect the longstanding structural and systemic inequities that are rooted in racism, sexism, and discrimination. And now that they've been laid bare, we really have an opportunity to address these inequities and in turn help to mitigate the disparate impacts of the pandemic and prevent further widening of the disparities going forward. So I like to see things as an opportunity. You know, I like to think of myself as a realistic optimist. And I believe that even bigger than COVID, we can narrow the disparities that we've always had. This is key to improving our nation's overall health and reducing the unnecessary costs of healthcare that we all bear, the cost for everyone. So what are the healthcare disparities and how did COVID-19 exacerbate them? And what are the broader implications of the disparities and the current federal efforts to advance health equity? So it's a big topic. I'm going to try and break it down into 5 bullet points or Q&A questions about them. The first one's obvious. What are healthcare disparities? So the National Institute of Health defines a health disparity as, quote, a particular type of health difference that is closely linked with social, economic, and/or environmental disadvantage. And the NIH goes on to note that disparities, quote, adversely affect groups of people who have systematically experienced greater obstacles to health based on a racial or ethnic group, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation, gender identity, geographic location, very interesting, especially when you think about Native American people, or other characteristics historically linked to discrimination or exclusion. Now, we don't just rely on that definition. We did a lot of homework when we launched the unit. The Centers for Disease Control and Prevention, CDC, identifies health disparities as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. So a slightly different look at what healthcare disparities are. And they go on to say that a healthcare disparity typically refers to differences between groups in health insurance coverage, access to and use of care, and quality of care. And they go on also to talk about health inequality and equity as related but slightly different. They talk about racism and gender discrimination and inequity, and the norms that assign value to determine opportunities around health based on color of skin, gender, etc. So in our work at WNYC and New York Public Radio, we are leaning heavily on those and other definitions, but broadly in our work, we define health and healthcare disparities as differences in health and healthcare outcomes between groups that stem from broader inequities. So it's very simple. We keep it simple. We don't have big definitions. And of course, there are multiple definitions of healthcare disparities. Now, health equity generally refers to individuals achieving their highest level of health through the elimination of these disparities in health and health care. So we're defining health equity as the attainment of the highest level of health and health care for all people. And that means valuing everyone equally with a focus on the ongoing societal efforts to address avoidable inequalities and historical and contemporary injustices in healthcare disparity. So that's where we are in that first question: what is a healthcare inequality, disparity, et cetera? And we know there are a broad array of factors within and beyond the healthcare system that drive these disparities before you ever get to a healthcare inequity. You know, often it's viewed through the lens of race and ethnicity, but there are a broad range of dimensions. And I remind people all the time about gender discrimination. Women who are responsible most of the time for family and healthcare are discriminated against, as we as women know, when they go to the doctor. They receive different health outcomes than their male counterparts. If they are women of color, still different. And then you add language barriers, citizenship status, obviously socioeconomic status, sexual orientation. All of these things affect health outcomes. So we are drilling down into this at the Race and Justice Unit. And during COVID, of course, all of it greatly illuminated, which gets us to the second question: what is the status of disparities in healthcare and health outcomes in our country? Well, prior to COVID-19, people of color and other underserved groups faced longstanding disparities in healthcare. And, you know, major recognition of these disparities, we were starting to talk about this when I worked in the Clinton administration for Hillary Clinton. It was a big part of that huge, this huge bill that went up to Capitol Hill, acknowledged the then Surgeon General's report that documented disparities in tobacco use, access to mental health care by race and ethnicity, but also gender disparities. But despite that recognition, we all know that healthcare bill, I hate to use the word failed, but it did. It was not successful. And despite the recognition of these disparities, overall improvements in population health have not occurred. Many of the disparities persisted and in some cases widened. Recent data from just before the COVID-19 pandemic hit, which that was mostly March. Some healthcare experts would say it was February, maybe even January, when we were looking overseas and we could see it coming. Recent data from December 2019 showed that people of color fared worse compared to their white counterparts across a range of health measures, including infant mortality. Really? In this country? Are you kidding me? But yes, infant mortality fared worse in pregnancy-related deaths. Really? In the United States in 2019? Yes, fared worse. Prevalence of chronic conditions and overall physical and mental health status. And life expectancy among Black people was 4 years lower than white people, with the lowest expectancy among Black men. And we just reported this morning, this isn't even in my notes now, I'm just ad-libbing, just this morning, life expectancy among Americans is down overall, down, not surprisingly, but the study said that even without COVID, life expectancy amongst Black men would still be down, and is down as compared to all of other racial and ethnic groups. So we've got to figure out what that is about. Now, the Affordable Care Act, Obamacare, which just survived yet another challenge in the US Supreme Court. as I think it was Samuel Alito, it might have been Gorsuch, one of the conservatives said the trilogy of the ACA, 3 cases in the US Supreme Court, all survived. And I'm happy to take questions on that if you like. But those expansions led to a lot of large gains in coverage across groups. But still, people of color and low-income individuals do remain at risk of being uninsured, even with Obamacare in place. And when COVID hit, we saw those disparities again laid bare. People of color and lower income individuals also receive poor quality care even when they seek care. And an undefeated survey found that Black adults are more likely than white adults to report not seeking care at all. The Tuskegee phenomenon, fear of the medical system. And I'm happy to talk a little bit more about that psychology, if you like. My father, Black man born in 1926, died in 2015, didn't like to go to the doctor, did not want to go to the doctor. I'm happy to talk about my personal experience with it and my professional experience with it and the historical reasons for that resistance for seeking medical care. This gets us to the third and perhaps most pressing question this morning. How has COVID-19, the pandemic, affected these disparities? In our reporting at New York Public Radio, and I'm sure you've seen this in the news you've consumed over the course of the last year, we found that Native American, African American, and Hispanic people have experienced disproportionate rates of illness and death due to COVID-19. Our reporting has also been that Black, Native, and Hispanic people have over 3 times premature excess deaths per 100,000 people in the United States in 2020 than the rate amongst white or Asian people. And that was the case in New York State as well. So the state was reflective of the national numbers. We have a reporter, Karen Yee, did a moving feature, and I urge you to listen to it, about the higher rate of death amongst young Latino men in New Jersey. And you can find that at Gothamist.com. It's Karen Yee, Y-I, and you can just search her name. And it's one of the most recent stories she did. She did it this past March, looking back at 2 families and their experience with COVID in the year that they lost the 2 men in their lives. And then a lot of data. She looked at the data, the rates of death among young Latino men in New Jersey. So why is this? Why did this happen in these communities? Well, even as we reported on deaths happening all around us, and cast your mind back, it's painful, but just cast your mind back, overflowing emergency rooms, morgue trucks parked all around us, all around the state. And we in our newsroom had people sick and dying. And of course, all of us had friends and relatives who were sick, and some of us had friends and relatives who were dying. I lost my mother-in-law during COVID. We still were grappling to understand why this was happening. And we learned our hypothesis, we proved to be correct. The higher rates of illness and death among people of color reflected increased risk of exposure to the virus due to their living, working, and transportation situations. And again, fear of going to the ER once he got sick. And then the increased risk of experiencing a serious form of the illness once infected due to a higher rate of underlying health conditions and the increased barriers to testing and treatment due to the existing disparities in healthcare. So a multi-layered problem, but all which we knew or should have known before we were hit with the COVID pandemic. And there's a lot of reporting on our website, Gothamist, if you want to dig more deeply. A lot of people don't want to dig more deeply. We've been living through this for 18 months, but it's fascinating and important to understand if we want to make a course correction. Beyond the direct health impacts of the virus, the pandemic has taken a disproportionate toll on the financial security and well-being of low-income people, LGBTQ people, and other underserved groups. We did a survey actually at New York Public Radio in February that showed about 6 in 10 Hispanic adults said their household lost a job or income due to the pandemic. Now, about 4 in 10 white adults said the same. So there's a lot of economic disparity going around, which will dovetail with our next conversation about reopening. And Black and Hispanic adults were more likely than white adults to report a lack of confidence in their ability to make their next housing payment. And they report food insecurity. And we've done a lot of reporting on the eviction rates and lack of employment, and also small businesses and even small landlords. I mean, everyone feeling the pain. I have to sigh. It's been a lot. I got to tell you, it's been a lot. All right, so that brings us to the next question. What are the broader implications of these disparities? Well, addressing the disparities in healthcare is the whole point, right? We want to know what we're dealing with so we can try to get a handle on it, try to fix it. We had a big health convening yesterday. I wish I'd had this talk with you before the convening. We had a big convening in our green space where experts came in and talked about things we can do to try to get a course correction going. Because that's the whole point of knowing all of this, not just to, to be stressed out and worried and wallow in our misery. The point is to try to fix it, So it's important not just from a race and justice and equity standpoint, but to improve the nation's overall health and economic prosperity. So that's our reason for doing the work. That's our goal. And people of color and other underserved groups, women below the poverty line, immigrant communities, the research suggests that this costs the country, these healthcare disparities for these groups amount to approximately $93 billion in excess medical care costs and $42 billion in lost productivity per year. And that doesn't include economic losses to premature deaths. So as the population becomes more diverse, which the latest census suggests it is, people of color account for over half the population by 2050. It becomes increasingly important to address these disparities. And again, I've said the COVID-19 pandemic exacerbated these underlying disparities, laid them bare, and increased the importance of addressing them. And the Biden administration has identified racial inequity, including health inequity, as a key priority. And they are working, or it is working, to address it in several of its agencies. Immediately after taking office, President Biden issued a series of executive orders focused on advancing health equity. I was going to go through them, but I will happily talk about them in the Q&A if you'd like. But I do want to mention one in particular that I think is critically important. The administration has launched several initiatives addressing inequities in maternal health. I was so delighted to see this. Just last month, April 2021, President Biden issued a proclamation to recognize the importance of addressing the high rates of Black maternal mortality and morbidity, but also the Centers for Medicare and Medicaid Services, CMS, has approved several state waivers to extend the Medicaid postpartum coverage period. So this gives women, poor women of any race, poor women, white women, Latina, poor women, extended postpartum coverage. And there are lots of problems that occur postpartum, and this will mean they remain covered. This starts beginning in 2022. It's a state waiver, meaning the states will continue to receive that federal funding. And the other thing Biden has done, the Human Resources and Services Administration announced a $12 million award for the Rural Maternal and Obstetrics Management Strategies Program. It's not a lot of money. I mean, come on, I worked in the federal government, $12 million, that's a blip, but it's something. And it will help develop some models and implement some strategies to improve maternal health in rural communities. So we talk about cities a lot. People focus on cities too much. We have a lot of rural communities that are ignored, and especially when it comes to maternal health, prenatal care, and then there's that controversial question, abortion. Okay, I'll just put that word out there. But I'm happy to talk about it. I will go there if you want. in the Q&A because it's on the Supreme Court docket next term, Roe v. Wade. So to sum it up, disparities in health and healthcare for people of color and underserved groups, including poor women of all races, are longstanding challenges in this country. You know, when the founders founded this country, and I am a big believer in our democracy, I think the founders did wonderful things, but they left two things out. Guaranteed education. Well, they left a lot of things out. They left Black people out, they left women out, but we've resolved that. We have a lot of work to do, but at least we've got a 19th Amendment and we've got the Reconstruction Amendments. But what we don't have in the Constitution is a guaranteed right to health care and a guaranteed right to an education. And John Adams wanted to put education in the Constitution. It's not in there. And Ben Franklin wanted to put the Reconstruction Amendments in there, and they weren't in there. We have a lot of problems to this day because of race, and there's nothing about healthcare. And look at other countries, and look at ours in terms of healthcare. And now the COVID-19 pandemic has laid bare these disparities and heightened the importance of addressing them. And as I've said, they're driven by the underlying social and economic inequities rooted in racial and gender inequality and discrimination. So I really believe that addressing the disparities is important, not only from the social justice standpoint, but for improving all of our lives, our overall health and economic prosperity. And we can talk more about how to prioritize equities across sectors, how to provide resources. You know, again, I'm not a health policy person. My job is to let people know where the problems are and then hope folks step in to start doing the work. So that's healthcare. Now, let's talk about something a little more cheerful. Reopening. Reopening. Today, New York State officially declared we move out of the healthcare crisis and into the reopening. New York State officially declared the state of emergency is over. Balloons fall, mic drop, yay. But don't get too excited yet. I said I'm a realistic optimist, and this is a day for that outlook. At our health convening yesterday, Dr. Celine Gounder, who worked on the COVID transition for the Biden administration and is an infectious disease specialist here in New York City, works at our main center for infectious disease, Bellevue Hospital. She said, do not think the pandemic is over. It is not over. It is still happening. We have other, she calls them mutants. We have other strains of the virus, but also more importantly, you know, there's a rarefied, she said, 1% of the population that is vaxxed, and a huge swath of the country and most significantly the world that is not vaccinated. And people move around. So she says we have to be hypervigilant. We cannot rest on our laurels. And the pandemic, she said, I'm not a doctor, I'm not a disease specialist, I am certainly not Anthony Fauci, but she says the pandemic will be with us for another several years. So I just want to, I'll put that out there because I feel it's my duty as a journalist to inform. If the news is good, I spread it. If the news is bad, I got to give it to you. So the state of emergency is over. What does that mean for your day-to-day lives? Well, it means you can walk outside without a mask, but it also means you can't get a alcoholic beverage to go anymore in New York City. No more to-go bevs. You know, my headline is New York will not look the same after the pandemic is over. That's sort of my headline. Economists are predicting a younger, poorer, and more eclectic crowd in New York City and probably New York State. There will be changes to everything from restaurant dining to entertainment to residential and commercial real estate. I have to say I'm kind of excited about this. I'm born and raised in New York. I love New York so much so that I've thought about running for mayor. I mean, I love this city, you know, uptown, downtown, east, west, every alley, every nook and cranny. I love the city. And the reason I love New York, and I love New York State. I mean, it's so beautiful in New York State. I wanted to come to Binghamton because it's so beautiful. I love it because it changes. I love it because it changes. I love the fact I went to a club when I was a kid called CBGB's. the hottest underground club. I saw the Ramones there. Some of y'all are too young to even know what I'm talking about. Shake your head if you remember the Ramones. Okay, yes, I see you. I saw the Ramones there, Blondie, before she was famous. I mean, it was great. It's gone. CBGB's is gone. I went over and did a little vigil and cried when they closed CBGB's. But there's something else there now that's cool. A little museum to the city of New York. So change is what New York is all about. This change is radical and sudden and the result of a horrific pandemic that ripped through our city and state. But I'm still excited for the change. I want to be here to see it happen and cover what is going to happen in New York, how our business is going to rebound, who is going to live here and who is going to leave. It's a once in a 100-year kind of change, right? We had the Spanish flu. We had Sandy. I lived through Hurricane Sandy. That was huge. 9/11, reported on that, of course, significantly huge. So we do have these moments where there's massive change in the city, and what comes out of it in our city and state and region, because we also cover New York, it can be magnificent if we are planning and thinking ahead. So again, economists are planning a younger, poorer, and more eclectic crowd. Barbara Durham, a senior commercial real estate economist with Moody's Analytics, says, quote, New York City will look just a little bit different. That's her quote. Hundreds of thousands of families, did you hear me? Moved out of the city, moved out during the lockdown. And many of them, she says, will not return, but some will return. So it's going to be interesting to see who comes back and who doesn't. Some people will do a hybrid work and life situation. And many people, the department in charge of tourism, which is called NYC and Company, they say a lot of these people are going to want to come back. They're going to want to come back. So the woman at Moody's, Denham, says the city will not get back to pre-pandemic levels until the year 2025. Sounds like a long time, right? No, think about how quickly the years go by. It's going to go very quickly. And 2025, in terms of economic reporting, is not a long time. That's not a long range forecast. And parts of the city are going to start coming back to normal much sooner than that. Monday, I went out to dinner with my kids. I had to be downtown for a meeting. I messaged my kids. I said, hey, let's go out to dinner. It's Monday. You know, things are barely reopened. Let's just grab a table somewhere. Do you know it took us an hour and a half? I am not exaggerating. An hour and a half to find a place to eat. We went from Uptown to Chelsea to Soho, back to Soho, back over to Chelsea. Finally, an hour and a half. I tweeted out that finding a table in this city on a Monday in the reopening is like finding a roll of toilet paper 1 year ago. That is how hard it was to find a table. So some things are getting back to normal right away. And will they get back to normal in time for the holiday season? Will we have tourists? Will all the restaurants reopen? Radio City Musical and the Rockettes, right? If the Rockettes are dancing, it feels pretty normal. Broadway shows are reopening starting this September, but will they be fully reopened in the fall? And what's their social distancing requirement? Because I don't know the last time you were in a Broadway show, but you're basically sitting in the lap of the person next to you, which, you know, is part of the experience, but who wants to do that now? and you know, it's really about restoring hope and faith in our tourism, in our city, and in the larger state. The experts we've been speaking to have said that Broadway will not, that the economy of the city will not bounce back. Listen to this, until Broadway reopens. Until Broadway reopens. I love Broadway, but really, that's when the economy bounces back. Charlotte St. Martin, who is the head of the Broadway League, says, until Broadway is open, New York is not open. So, you know, maybe that's true, but she has a vested interest in saying that. And as I said, Broadway is starting to reopen in the fall, but 4 out of 5 shows on Broadway cannot recoup their investment until they've been open and fully seated for several months. They lost so much money. And then there's the issue of their costumers left the city, their orchestra members left the city. A lot of the Broadway people left, makeup artists, they're gone. So are they coming back? They're working on updating checkpoints inside the theaters to make them more touch-free, but there's a lot of pent-up demand to get back into Broadway. And then once Broadway's back, tourism starts to return. 38 million people are expected to visit the city by the end of 2021, but that's half the normal amount. Half the normal amount, but of course, much greater than during the pandemic because nobody was coming. And for those who are not New York City focused, tourism in New York City extends to the rest of the state. People come to New York City and then they say, hey, let's take a drive up and see Harriet Tubman House. Let's take a drive up to Albany and visit the Capitol. Let's check out the beaches in Long Island. So there is an impact on the rest of the state when tourism is high in the city. Other experts that we've spoken to say the ship will turn, this is a quote, I see the ship turning later this summer and into the fall. I just feel an extraordinary excitement about returning to New York. And everybody agrees the city needs tourism to survive. Think of all the major landmarks and attractions, the Statue of Liberty, Ellis Island, the Circle Line. I mean, I don't have to tell you, you know all these things. All have been shut down for a year. So everyone's placing a lot of hope on the third quarter of 2021 because of the vaccine rollout, the enthusiasm of people to travel. And the city is heavily marketing the new New York to anyone who lives within driving distance. I'm talking to all of you. Anyone who lives within driving distance, please come on down. And then, of course, we're going to branch out from there to the coast and coast-to-coast travel once people get more comfortable with getting on an airplane. I've been on an airplane, by the way, throughout the pandemic, and I'm happy to answer any questions about my first flight during the pandemic, which was, I was in California when everything shut down. I was in California when everything shut down, visiting my then 88-year-old father-in-law. Then I flew back with a crowded plane full of people who I'm sure some had COVID. I'm sure they did. And I've been going back and forth ever since. So I've been on planes throughout, and it's been a surreal experience to watch the change in travel during COVID. Restaurants with patios are now lining the streets in New York. I don't know how many of you have been to New York, but just the landscape is completely different. We have these sidewalk cafe bubbles all over New York City. A draw for people to eat outside, but if you have to park your car, you better plan on parking in a garage. There's no more, no more street parking. And many restaurant owners survived only because of the outdoor space. I have a couple of friends who own small cafes, and that outdoor space saved them. And some didn't survive, of course. That's a big part of our story of reopening. Will the bubbles be permitted to stay there? Well, New York City needs to consider that. New York City's restaurant industry has been absolutely devastated. We spoke recently with the executive director of the New York Hospitality Alliance. He says, quote, we've lost thousands of beloved restaurants, and there are still countless more teetering on the edge of survival. Now he's asking for help from local, state, and federal leaders, and he's hopeful he will get the restaurants will get some assistance. But I do agree with him that we need to seize the moment to rebuild during this reopening and get restaurants back on their feet, and think of all the people restaurants employ. It's not about the people who come and sit there and enjoy the meal. It's about people who work there, the waiters, the bartenders, the bus people, the managers, the hosts. It's a lot of economy right in that industry. And hotels have been hit, of course, even worse. Hotels just have not been able to survive. 140 hotels shut down in New York City since last March. Most will not reopen. Some were used as homeless shelters. I don't know how much you followed the controversy around placing homeless people in hotels. Huge controversy in the city. Happy to talk about that if you'd like in the Q&A. There is some light at the end of the tunnel with regard to hotels. These hotels had no occupancy, none. But again, there's hope that there will be some support from local, state, and federal officials, and people are starting to come back. So hotels that were able to stay open and to create touch-free temperature checks, for example, they offer you slippers when you walk in the door and plastic covers for things if you want them. Those hotels may be able to pull through. And then, of course, the most important thing is bringing jobs back. More than 900,000 people, this is just New York City, I'm giving you, lost their jobs since last March. That's more than 5 times the number of jobs lost after 9/11. Think about that. And remember, any of you who remember 9/11, I was actually at ground zero that day. So I remember it, it's seared into my soul. That decimated the city. So now we're talking about 5 times the number or the amount of jobs lost after 9/11, 900,000 people. And those are the reported people. So it's probably closer to 1 million. And we recovered after 9/11. So again, I'm a realistic optimist. We are so resilient in the Empire State. There's so much faith in our economy. I do know we will come back, but that is the major issue. And finally, we're having a rent reset. I mentioned rent when I was talking about healthcare and housing disparities. We believe that we're seeing, as we report this out, both from the landlord's perspective, commercial landlords, small landlords hit horribly, and then renters, they're all thinking about rent. Rental prices dropped by 15% citywide, and so we're seeing a rent reset. Economists are predicting new businesses will reoccupy all of those empty storefronts that you see when you visit. Retail shopping starting to pick up. If you want to see the New York City pandemic captured, and the state, and even New Jersey, which we cover as well, captured over the course of the last year, Gothamist, which is our website for WNYC New York Public Radio, pretty much did a day-by-day update of the pandemic over the course of the last year and covered everything from healthcare to the protests, almost a TikTok of the protests, as well as economic developments. And you could go there and just type in COVID and everything will come up. You probably don't want to do that, but if you have a particular interest, that is where I would send you. And I think with that, I will end. Those are, today is officially, as I said, the day on which the governor has said the state of emergency has ended. So I would say it's the official day of reopening in New York State. But again, I would implore you not to think that COVID is over. It's not over. But I hope when I see you in person in the future, we can, I don't shake hands anymore. I'm borrowing from the Japanese. I do a respectful bow and on occasion an embrace of someone I haven't seen in a long time. So I will see you and I'll give you a respectful bow and perhaps an embrace for 1 or 2 folks that I haven't seen in a long time. And with that, I thank you for your time and attention. And I'm delighted to take any questions that anyone has on any topic.
Jamie, thank you so much. That was certainly a wide-ranging and really interesting talk, and so newsy. We appreciate you bringing us things that, right up till this morning. Just fantastic. We're going to take a moment and gather up some questions from the audience. Folks, I do invite you to post your questions into the chat box or send them to me directly, as some of you already have. And we do have just a few slides featuring the mission and impact of the Women's Fund that we wanted to share with you while we do that. The Women's Fund mission is to improve and empower the lives of women and girls in our region through collective and engaged philanthropy among women. We'd like to tell you today that we have surpassed our fundraising goal of $1 million. and made over $225,000 in grants to 70 projects and programs throughout our 5-county region. The programs touch on things such as women's entrepreneurship, sexual violence and domestic abuse, financial literacy, character and leadership development for girls, and many, many more. And we look forward to celebrating that milestone with you later this year. We're also looking forward already to our 2022 annual breakfast, hopefully to feature actual breakfast. All right. So Jamie, we do have some questions already in the queue for you. I'm going to feed them to you if that's okay. And we'll get started with a very challenging subject. You mentioned life expectancy falling during the pandemic. One of our guests this morning asked if you could speak to the role of overdose and suicide in that statistic.
Yeah. I can. I don't have the numbers right in front of me. It's quite interesting that to the extent we reported on it, overdose has, of course, we've covered quite a bit. I would call it a pandemic indeed, but an epidemic in our country, pandemic referring to global, the epidemic in our country of opioid addiction and death. I do believe that the attention paid to it is quite interesting because we've had an addiction problem in this country for decades with other things, with other drugs, meth, cocaine, both crack and powder, and also alcohol addiction is a horrible problem in our country. Alcohol being legal, people don't talk about it as much, it's swept under the rug, but we have an addiction crisis in our country. And the opioid crisis, which intersected with the manufacturer's complicity, in fact, criminal behavior, you know, and I don't want to get myself into a slander or libel situation, but you know, there is litigation around that. That brought everyone's attention manifestly to the problem of addiction, principally around opioids, but then people began talking about the rest, and that's a good thing. During COVID, of course, the rates did rise. I don't have the numbers in front of me, but we did report on the rise in addiction, especially for people who are living, let me correct that, the rise in use, especially for people living at home. There is a woman, I'm actually going to look up the book right here. Bear with me. There is a woman who came on our air and did a whole story about drinking during the pandemic. She'd written an article and she based the article on this book. I'm going to mention it to you. It's called Drunk: How We Sipped, Danced, and Stumbled Our Way to Civilization. How We Sipped, Danced, and Stumbled Our Way to Civilization. The main title being Drunk. And the author is Edward Slingerland. Edward Slingerland. And a woman came on to our program, I would say about 2 weeks ago, to talk about very openly her drinking during the pandemic. And an article she wrote about how people drank too much during the pandemic. So this wasn't about opioids. It wasn't about, you know, hard drugs, but it was about addiction. And she talked about addiction in lonely spaces during the pandemic and how people, especially those who are alone, were more inclined to use substances of all kinds because they were alone. And I will also say anecdotally, I know that I wish I had fewer people in my house. I have a full house, but I know from my experience with some friends that this was a problem, including one who passed away. So I think it's a very pertinent and poignant question. I don't have the statistics right in front of me, so I don't want to say more about it. The only other thing I will say is that we've done a lot of reporting on NYPD suicide. And in the course of the last 2 years, so even before the pandemic, there was a rise in suicides amongst officers in the NYPD. And we reported a lot on that, and we cannot figure out why that was. It was not pandemic related, but it continues to be a problem. And the last thing I'll say is that in my own family, boy, I'm going there. I'm with women. I feel good. I feel safe. In my own family, we've had addiction and we've had suicide. And we've not talked about it. There's this, as I'm sure many people in this room know, if not everyone, there is a tendency not to talk about things. I had an aunt who committed suicide, my mother's sister, very traumatic for my mother. She was 17 years old. And this was her favorite sister. The woman committed suicide at a very young age, 2 little girls left behind. And I didn't even know this woman existed until I was a teenager or very close to adulthood. Because we don't talk about that. Why would we talk about that? My husband had the same exact experience with his aunt. And there was addiction on both sides of the family. No one talks about it. And you got to talk about those things, especially the addiction, because that is biochemical and families need to know that that tendency is there. So I think it's good that we are a society that is now starting to talk more openly and honestly about these things. And I really appreciate the question.
Jamie, here's another sort of difficult, sensitive topic, but I hope that you'll have some thoughts for the person who asked this question. There's, you know, you mentioned that postpartum issues are being addressed better now, but do you have thoughts about, you know, what women could do, how the health system can respond better for women who show up, they know something's wrong, they're in discomfort, and it seems that they're not believed or
Right.
their fears are downplayed. You know, what can we do to address that, either as women to express ourselves in some different way, or what can we hope for better from the healthcare establishment?
Such an excellent question. And I was alluding to that in my talk. Thank you so much for the question. So I don't know how many of you are aware of Serena Williams' experience. Serena Williams, the famous tennis player, I will say the famous Black tennis player. And the only reason I say Black tennis player is because she says that she experienced exactly what you're asking about with her delivery of her baby. She was not listened to. She was not taken seriously. She had a very, very difficult delivery and says that when she got to the hospital, people would not hear her. They did not listen to her. They didn't see her in the same way she feels they would have seen a white woman. And I believe her. And I'll tell you why. When I had my second baby, I had the same experience. And look at me. I don't look that Black, but I had an afro at the time. And when I have an afro, I look a little more Black. And I went to the hospital. I could not get them to give me that epidural, to listen to me, to hear me, to look me in the eye. And I didn't really think of it in the way Serena, because I'm of a certain generation, right? And I just didn't, we weren't talking about these issues at the time. And I don't think it's necessarily, I think, okay, so here's what I think. Here's what we can do. First of all, always go to the hospital with an advocate if you can. Obviously, if you're having an emergency on the street and you fall out, you're going on your own. But if you don't feel well and you're going to the hospital, take your sister, take your husband, take your wife, take your best friend, take your neighbor, take someone who is going to stand there and advocate for you. Because when you aren't feeling well and you're sick, and especially if you're a woman first, they don't listen to us as much, and woman of color most of all, you need somebody standing there with you to say, hey, did you hear what she said? She's in pain. Or no, she did not say she's nauseous. She said she's seeing double. Or you need somebody who's going to back you up in that room. Now, if it's not a family member, they can't make medical decisions. If you haven't designated the person to make medical decisions for you in the case of your lack of consciousness, then they can't do that. But it's better to have somebody there with you than no one at all. And ideally, it's somebody who's your healthcare proxy, which gets me to the next thing. Everybody needs to think about end of life issues. Everybody, 25-year-olds, 30-year-olds, 40-year-olds, 50, obviously. When you get to 50, it's time. And certainly anybody over 50. Designate a healthcare proxy, because you could be 30 and hit by a bus. That's not about being old. You want to know that somebody you trust is going to make decisions for you when you get to the hospital that you would make for yourself, and make sure the proxy understands that's what they're doing. They're not making the decisions they would make for themselves. You have to choose someone who will have the strength and courage and integrity to make the decision they know you would make. So you need to take someone to the hospital, have a healthcare proxy designated, and by the way, do other things to establish what you want done. If you are in a vegetative state, do you want a feeding tube? What's going to happen at the end of life if you get there sooner than you expect? All of those things. And there are online programs to help you with this stuff. Sorry. Oh, wait. How lucky is this? Okay, wait. People, you are so lucky. Women. Okay, there's a website. My dear friend Jeffrey Gardier, who is a Black, very public Black psychotherapist, he helped establish a site. It's called Medical Aid in Dying. And there's also another one called Compassion. I think it's called Compassionate Choices, but it might be Compassion in Choices. But anyway, my point is, there are all kinds of sites online that will walk you through step by step the things you need to think about before you ever get to the hospital. And by the way, you're having a baby? You think you're young and healthy? Things go wrong. I was young and healthy, nothing went wrong. But you need to be prepared in case something goes wrong. So get the healthcare proxy going. Write down, I do not want a C-section no matter what. Or I want a C-section if something's going wrong. Write it down. Don't just discuss it with your doctor, because guess what? You might go into labor and your doctor's on vacation. So write it down. So those are the things we can do to protect ourselves. Take someone to the hospital with you, write everything down, get a healthcare proxy in place, and communicate clearly and loudly. And if you have to, say, hey, I feel like you're not listening to me because I'm Black. That'll get their attention. I wouldn't go there right away. Hey, I'm a woman. I feel you're not listening to me because I'm a woman. I wouldn't go there right away, because then, everybody gets into a different headspace and it becomes contentious. But if you have to, if push comes to shove, communicate that. I want to see the attending. I don't want to talk to the resident anymore. I need to see the attending now. Where's the attending? Because I feel that you're not hearing me. So, and always say, I feel you're not hearing me, because then the person doesn't get their back up. So those are my thoughts. After, the long life that I've lived, and I've spent a lot of time in hospitals, so much time in hospitals. I cannot tell you, my father was in and out of hospitals the last 10 years of his life. I've spent so much time in hospital, and I've done a lot of hospital coverage. I've done neonatal, prenatal. I've done a lot of coverage in hospitals, and there is total truth to what Serena says. It is totally true. I mean, one last thing I'll say. There was a story when a white woman had septuplets. This was probably 15 years ago. Then this Black woman has octuplets. When the white woman had the septuplets, oh, isn't it so great? Septuplets. Then the Black woman has octuplets. What's this woman doing having all these babies? That's the difference in the coverage at my news organization at the time. It was like, what is wrong with America? So that's what we're dealing with. So I hope I helped a little bit there.
Jamie, thank you. Thank you both for sharing your experience, but also for those really tangible, practical suggestions. That was excellent. And now we have actually a pair of questions sort of looking to you for advice. So one woman on the call today asks, what advice do you have for women who feel unheard or undervalued in their workplace?
I'm sorry. I'm laughing because I've been in a lot of workplaces and I know how you feel, girl. I don't know your name. I wish I did, because I'd say it. Say her name. Okay. Here's the thing. First of all, women don't get paid the same thing as men. We got to change that. I was going to give a talk originally about women in politics. and I was going to talk about all the different women, all the women who've run for president. And do we have a woman president? No. Have we ever had a woman president? No. Meanwhile, these countries like Pakistan, I mean, they don't value women, but somehow they elect a woman president. So the problem is manifestly cultural in our country. We have a problem with women in power, in leadership, in the workplace, in the hospital setting, in the higher education setting. Fine, a woman can teach kindergarten, but she can't be the president of this university. What? We don't see women at the anchor desk, right? I mean, Diane Sawyer held onto that desk. It took her 63 years to get there, and then she held on. I mean, come on. So this is a persistent cultural problem. And the very first woman who ran for president, in her platform, she had equal pay for women, equal pay for equal work. And here we are still talking about that. So, and she was running against Ulysses Grant. So we're talking I don't have the notes right in front of me, but 1872. Yes, I think that's right. Okay, so here we are in 2021 still asking for equal pay. So if we're not paid the same, we're not valued the same. You know, I'm all about Jerry Maguire. Show me the money. Show me the money. You know, when I get to a job and I find out, and this has happened many times to me, I look at, and in news it's hard because it's a subjective valuation. You know, if they think Peter Jennings is worth more than Diane Sawyer, to use two of my mentors, they can just say, well, we're going to pay Peter 12 million and Diane 8. And that's the nature of our business. So it's a lot harder. But if you are two anchors of the same show, why should Robin Roberts make less than George Stephanopoulos? I don't know that she does. I'm using that as an example. She probably makes more, but they should make the same thing for that work. That's just an example. Again, clearly an example. ABC, don't get mad at me. Why did I use ABC as an example? That's where I work. I work at ABC part of the time, by the way. So, and by the way, I want to say about ABC, I feel that they did value me as a woman, and the women generally quite, they were forward thinking. I mean, they did put a woman on the anchor desk. The nighttime, did any other show? I don't think the other networks have done that yet. And now they've done it. They've just done it. Post Me Too. Post Me Too. We had to have Me Too for these organizations to start to recognize the women. But ABC had Diane before that. So how do you make sure you're recognized and heard? You know, I'd love to, whoever this person is who just asked this question, I welcome, please encourage them to reach out to me directly. I mentor a lot of young women. This is a conversation, young women who are in law school, young women in their early career, and also my peers and mentors. We talk about this all the time. It is a very nuanced answer and hard for me to answer in a group setting. You know, it depends on the workplace. It depends on how many allies you have. It depends on the culture in which you are working, the culture of the profession you're in, as well as the workplace itself. Sometimes you have to be really bold and just say, I feel like I'm not being valued here. And if this, and this doesn't change, I'm going to have to leave in 6 months. Sometimes you really have to go there. And I've done that. In fact, I left ABC. And now I'm back. But sometimes it's much more, you have to be more strategic, more careful, more nuanced, and just try and outlast the people who aren't valuing you until they go. And then the new people come in and suddenly they value you. It's very complicated. It's very complicated, and it really is an incremental thing. And I go back to the women in politics example from Virginia Woodhull, that first woman who ran for president, to Hillary Clinton, who's run twice and lost both times, and all the women in between. Each of those women has opened the door to the woman who will finally win. And that's what we're all doing in the workplace. each time we make a more equitable workplace through our words or our actions, through our struggles. And girl, I know it's a struggle. Whoever you are who asked the question, I'm with you, I feel you. But every single day we are making the workplace more equitable for our daughters, nieces, mentees, the women who are coming in our footsteps after us. I really believe that. So stick with it. And if you really want to talk more in detail about your situation, I ask the organizers to share my contact information.
Thank you so much for that. We had a question from someone who says that our local NPR station, our local public media station, I should say, WSKG, recently launched its own rural health desk, and that reporter is on the call with us today.
Oh, great.
This person wondered if you had any advice for her, and I know there's several people here from WSKG, so maybe you want to take a moment and speak to your colleagues in public media to, if there's any sort of advice or guidance that you would want to extend to them.
They probably have some advice and guidance from me. Well, the first thing I would love to say is we often have contributors from other stations around the state, and we would love to be in touch with you. That's what I say. We have Charles Lane from WSHU who comes on all the time. We have people from Above the Law, which is a website about the law, who come on and contribute stories. So I'd love to, I work as an editor with people who are not permanently in my unit, but contribute stories about the various inequities, stories they see in their region that they feel our listeners would be interested in hearing. And Binghamton is slightly out of our region, but I have enough pull, I think, to get a good story on. But in terms of advice, well, no, except to say, I hope you're leaning into these issues in your reporting. I mean, what we've decided, the reason we call it the Race and Justice Unit as opposed to the Race and Justice Desk, is all the desks continue to work as they have. And you know what they are: politics, education, city hall. Well, city hall's in politics, but education, transportation, the traditional desks. We have an investigative team, but all of them intersect with this unit. So I have my reporters who report on race and justice specifically. We have Arun Venugopal on hate and bias. We have a policing reporter, George Joseph. So we have a Day of Air reporter, Joseph Jetty. And so we have our reporters, but all of the other desks come to me when they have a story that they feel is race forward. So if it's an immigration story, it's an immigration story. But if it's an immigration story that intersects with the justice system, because we're race and justice, they bring it to me. So I would urge you to think about your stories through the lens of race, gender, and other inequities, because almost every story is rooted in that. This is America, as Childish Gambino said. That's my only advice. It's not even advice, it's just an ask. It's a request. But I'd be happy to have a conversation with you, a meeting with you. We recently did a tour of the country and met with a dozen other stations, including some commercial stations, to rethink our journalism and restructure our newsroom. So I'd be more than happy to do a little Zoom or conference call. That would be great. I'd get a lot out of it.
All right, WSKG folks, that's a pretty good offer. You can message me if you need Jamie's email address, and we'll get you in touch with each other. We had someone on the call who asked if you would speak more to the green space discussion that you mentioned briefly.
Yeah, I saw that, and I can do better than that. I can refer you to, I have to look at my Twitter feed. Let me give you my Twitter, @Jamie Floyd. It's just my name, @Jamie Floyd. I'm looking at my Twitter feed because it was posted yesterday, and you can go and see it. It should be at the top of my feed. Okay, so it is posted at the Green Space, I believe, and also on YouTube. Let me I wish I could share it, but it's stuck on my phone. So
you've been posting links as you talk, Jamie. So if you want to tell us enough about it, I think Jackie Stapleton Durham will get a link into the chat for us.
Yes. Okay. So I'm going to tell you more about it. So, and then maybe I can share a link. For some reason, the link isn't showing up. So what we did is we had, we're going to have a series of these. And we talked, it was three, see that, I'm so tired. We had 3 panels. And it was moderated. We have a new health editor. So that's another thing we did during COVID. We have a new editor-in-chief, Audrey Cooper, and she established a health and science desk. Now, we've had on and off health reporters, but this is a whole desk dedicated to health and science. Thank God science, right? Because we have so much scientific illiteracy in this country. But he also is a health editor, and he's fabulous. He has a PhD in biochemistry. He also has a journalism background, so he's a great editor. And he was his name is Sikan Akpan, and he was the moderator, and he brought this together. And it was 3 panels. The first was the future of the mRNA vaccines. So what's happening with these vaccines? Is the one-shot vaccine enough? What's going to happen when the mutations come? How often are we going to need boosters? That's the kind of thing they talked about. And he had Celine Gounder, the woman that I mentioned, Dr. Celine Gounder. And he also had Dr. Jeffrey Harris, who is a professor of economics at MIT. And what he spoke about was the expense to the government of dispensing these vaccines, and how do we make sure they're equitably shared with everybody? How do we compare to other countries, that kind of thing. And Celine talked about the medicine of it. And then the second panel, which I loved, as you can imagine when I tell you what it is, it was called Black Lives, Mental Health, and Policing in New York. Big topic, but the guest was fabulous. It was Mary Bassett, who was, for most of the de Blasio administration, the director of health and human services in the city. And she was great. And she talked about all those topics. She might be an interesting, well, she doesn't have a Binghamton tie that I know of. Not everybody is great in the Binghamton world. She might, I'll look, I don't think so. And then the last thing was, this was a hard panel. The last panel was about long haul COVID. You know, people who suffer the long haul effects of COVID, and an array of doctors speaking about that. So that was the panel. I believe it will post. It's not posted yet. I believe it will post at thegreenspace.org. They post all of their events there, but it's not posted there now. That
And
gives
we
me some.
actually have one of the participants posted a link for you, so
Oh,
it's there.
Thank you.
Thank you, Dr. Riley, for saving us. So
Thank
good.
you.
Yeah.
It was really quite extraordinary, and you could just listen to one segment of it. You don't have to. You listen to the segment that interests you.
Thank you so much, everyone, for your great questions. We're going to leave it there with Jamie, and I'm going to turn things back over to Sandra Johnson now, who has a few closing announcements for us.
There we go. Jamie, thank you. That was absolutely fabulous. Thank you again. Thank you all for joining us this morning, and we appreciate all your support and donations. If you'd like to help us with future grantees, your donations would be appreciated. Please look for the link that's on our site in the chat and donate this morning. Congrats to everybody who won the door prizes. Please take a look and see if you're listed, and we will be contacting you. I think we're putting that up right now. And then make sure you stay tuned this fall for our upcoming event to celebrate our reaching $1 million goal. And let's not forget our 2022 breakfast, which we will, fingers crossed, hold in person next year. So thank you everybody for coming, and don't forget to pay it forward, and have a great day.
All right, so your names are on the slide if you want a door prize. I believe when you registered, we got your address, so we'll be in touch with you directly about making a delivery or putting something in the mail to you. Thanks again for a wonderful event, and thank you to Jamie for time and attention this morning. Everyone did an amazing job thinking on their feet, asking some great questions, and we so appreciate your replies to us as well.
Thank you.